These are really emotional stories. While I was listening to the stories of these families, my flesh kept creeping. Will you please comment on the cases of our guests today? You know, my flesh always creeps when I hear stories and see situations widely spread even after so many years of work. There are always the same sad experiences, and I really shudder. But now I have been pleasantly refreshed by all those smiles of the families here. It's a great problem indeed, and it's sad to hear how those patients suffered. I must say that this institution has been established with the aim to put an end to some old attitudes and to look at modern ophthalmology with our eyes wide open and to give a chance to a young population as well, from the youngest to the oldest. During the conversation, I noticed that the parents were really well educated. How much is their role in the mere recovery, in the mere procedure leading to good vision important? How much is it necessary for them to be educated and understand the core of the problem and to be brave? This is very important. In fact, this is essential. When you notice a problem in a child, you first talk to the parents. You should find a simple way to explain the problem to the parents so that they may understand the essence. I keep saying that doctors aren't miracle workers and they mustn't mystify any problem but rather explain it to the patient. And doctors aren't judges either. It's not up to us to say, you know, there's no cure for you or we can do everything. A doctor must make diagnosis and he must make all possibilities available. He may recommend one of regular institutions that can solve the problem in a standard manner. If this is not possible, the doctor is lawfully obliged to inform the patient about the manner of treatment. If there is any possibility of treatment, whether it's small or great, the doctor must say it. Therefore, when you inform parents or a patient about a problem, you give the possibility of treatment and an objective assessment of the condition, while it's up to the parent or patient to make a final decision on accepting or rejecting the procedure. I must ask you something for all young parents who are watching us at this moment. We had examples of really young children with visual problems. When is it necessary to visit an ophthalmologist for the first time? And are there any symptoms that parents can notice in their children and that indicate that something is wrong? What I may single out from all these stories is the parent sentence, "We haven't taken our child to the doctor." I think the society should make it obligatory for a systematic examination to include an ophthalmologic examination as well. What should it be like? How is it supposed to be according to medical standards? In children, systematic examinations are performed immediately after birth. A systematic examination should include an ophthalmologic examination as well. This needn't be obligatory only for premature children with whom the most serious problems may occur when you must react fast. These are situations in which it is necessary to react within a month or two. What about other children whose parents are not educated? They aren't doctors. They aren't healthcare professionals. They're not supposed to have knowledge. Therefore, I think that the society should make it obligatory for a systematic examination to include an ophthalmologic examination as well. What shall we get in this way? We'll discover congenital glaucoma early. We'll discover congenital cataract early. We won't discover any refractive or diopter problem, as these problems may develop later. But a large number of children are amblyopic or blind because some problems that could have been solved aren't solved because, for the God's sake, the parents didn't take the child to the doctor. This is why parents blame themselves a lot, but they shouldn't do that. They aren't to blame.
Tu roditelji osjećaju vrlo veliku krivicu, a ne treba. Oni nisu krivi.